Hello, and thank you for joining us on the Stay Healthy San Diego podcast, brought to you by Parker Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community. And now, introducing your host and author of Aging Smarter, Dr. Matt Parker.
Welcome, everybody. I'm incredibly excited to have our guest on today. She is a graduate of the Tri-State College of Acupuncture. She practices trigger point therapy, acupressure. This word I'm going to mispronounce here, but I'm going to go for it. Zheng Gu Tui Na. Did I do that right?
Zheng Gu Tui Na.
Okay, that was about close enough, we're going to say. So she does Chinese medical massage. She does Chinese sports massage. She uses patent herbs, gua sha, 5-element theory. She's currently a yoga and a meditation practitioner, and she's actually working on her doctorate in acupuncture. I want to welcome on Lindsey Miuccio. I hope I got that right. Lindsey, is that good?
You did. Excellent. Good
job.
Wonderful.
Wonderful. So, Lindsey, I want to welcome you here today.
Thank you.
I always want to start with people's story, like where you're from, what got you to this point, why you do what you do. So can you start from the top? Where are you from?
Sure. I am from New York City.
Okay. Where in the NYC?
From the Bronx, and then I lived in the Hudson Valley up by George Washington headquarters.
Okay.
Yep, did high school up there.
Okay.
And then went back down to Pace University.
All right.
And then made it into Manhattan and was there for all of my 20s.
Okay. So you're in Manhattan for all your 20s.
Mm-hmm.
And then what are you doing in your 20s there?
Besides trying to survive.
Yeah, I heard it's an expensive place. That's what they tell me. So according to the internet there, but...
It is. That's where I started my acupuncture training, my master's in acupuncture.
So where did that come from? Like, where's your love for acupuncture? How'd you get into that field?
I was in for a master's in psychology.
Okay.
And the very last semester, I realized that I didn't want to sit behind a desk for the rest of my life.
Understandable. Same.
And the professor said in the class that if your heart isn't in it, this isn't the place to be. And I shut my laptop immediately and walked out.
Wow.
Yes.
Okay.
And then I was like, what am I going to do with my life?
Okay.
And a few months later, my aunt said, I'm going to the acupuncturist. Do you want to go with me? And I said, sure. I don't know what it is. There might be needles. So whatever. I'll go. So I was 23 and hungover.
Okay.
And I walked into the office with her. And the practitioner put my feet in this ionic bath. And
Ooh.
within a few minutes, I was no longer hungover. And I knew that this would be something special.
Wow.
Yes.
Okay. So you get the ionic bath and then...
Ionic bath. And then she put me on the table. Uh-huh. She pressed my abdomen, the lower left quadrant. And I was in terrible pain, almost jumped off the table. And then she pressed a spot on my ankle, went back to my abdomen, and the pain was gone. And I looked at her and I said, you're in the wrong spot. And she's like, no, I'm in the right spot and I'm deeper. That's the area for the blood flow from the intestines and the colon back to the liver. And when you're stressed, like we all are, it's stuck. So that's the moment that the light bulb went off, that I can help people transform instantly on the table. And I don't have to be behind a desk and still help people achieve. Yeah.
Incredible. So go to master's school, and then you're still in New York at this point. So
Still
where did California come into play here? How are you down here in sunny San Diego at the Stay Healthy San Diego podcast?
I did not want to come here at all. I was totally against California.
And why is that?
No seasons, too sunny, people smile all the time, you know.
Too sunny. Okay, yeah, that's a weird complaint. Different. So, okay. But you eventually got here, so someone convinced you to come over.
Yes.
So who was it?
That aunt, once again, was like, what are you doing? Why are you staying here? It's like it's a hellhole. I don't know if I can...
You can say that, so earmuffs for those under 18, please. So.
And for months I fought it. I'm not doing it. I'm not going out there. And part of my family is here.
Gotcha.
And she's like, your family lives on the beach. Why don't you want to be there? And I'm like, no, I'm a New Yorker. I'm staying in New York. And then a few months later, after shoveling snow every other day, I was like, packing up. I'm going. Hands up. I give up. I'm going to California.
Shoveling snow. I've never even know what that looks like, so I'm always on my sandals out here in California.
Oh my gosh.
So I know. Okay. So you come out to California.
Yes.
All
come
right.
out to California. I started with Lululemon for the first couple of months.
Nice.
Yes. My crew is over there.
And you're
Love
still
them.
doing acupuncture on the side?
So I am doing massage at that point in time when I
Gotcha.
come over.
Okay.
Yeah. And then within, I think, 3 months, that fall, that April, I started my master's, a 4-year master's in acupuncture and oriental medicine. So now it includes herbs at PCOM, so Pacific College of Oriental Medicine.
Gotcha.
Yeah.
Okay. And then you eventually transitioned to starting your own business.
Yes, that was maybe like a year later.
Is that something you've always wanted to do, to have your own business?
Yes, since I was 19, I've always wanted multiple businesses of wellness centers. So.
More than one.
More than
That's
one.
the dream. Okay.
Yes.
So your current business is called what now?
Akasha Acupuncture on the East Coast and Acupressure on the West Coast.
She's already on her way. She's already got more than one business going
Yeah.
on. So I know you treat a lot of the classic things. You treat back pain. You treat neck pain. You do headaches, migraines, elbow pain, the full gambit, yogis, CrossFit athletes. But I want to talk about more of the stuff that we may not know about that you treat that, the common population may not know. Tell us more.
I think stress and anxiety. Everyone comes in for pain.
Okay.
And because people will be like, well, I'm not in pain, nothing hurts, my limb's not hanging off, I'm good. I'm like, oh, really? What about the list of these 10 questions, like a 45-minute intake of, hot flashes? Are you sleeping at night? Do you have insomnia? Easy to go to sleep, stay asleep. Digestive issues, a lot of digestive issues, skin issues, all over body rashes, acne. I mean, you name it. There's IBS. Women that are looking, so my age, they're all looking to get pregnant at this point in time. So help with that, balancing out hormones. I work on a lot of younger athletes too, like 9, 12, 17, like little kids.
Incredible.
So that's fun too.
And again, it's hands-on, and it's needles, and it's diet as well. Like, what kind of things are you working on?
A little bit of everything.
Okay.
So absolutely. Depending on what the issue is, how old the person is.
Gotcha.
Cupping.
Okay.
Guasha.
Nice. Well, I want to backtrack a little bit because you mentioned 10 questions on the intake.
Oh, yeah.
Because I love that. So tell me more about these 10 questions. What are you asking people?
So with traditional Chinese medicine, we look at the whole person. So each person that comes in, let's say 5 people had diabetes, we look at each one individually to see what the root cause is. And these 10 questions help us it's a filter for us to use to diagnose. So the first one is, are you hot, cold, chills, fever? Are you always feeling cold? Do you run warm? Are your hands and your chest warm, your face warm, your feet warm, or are they cold? There's perspiration, night sweats, spontaneous perspiration without physical activity. That lets me know if your immune system is low. If you have a high fever and don't perspire, or if the palms and your soles of feet are sweaty.
Interesting.
Then I ask you where your pain is. Head, body, back, lower back, knees, chest, tight rib cage. Is it sharp? Is it dull? Stabbing? If it's relieved by heat, or worsened by cold, or pressure. And then dizziness would also fall into this category. And then I ask about urine, bowel movements, frequency, color, all that fun stuff.
Awesome. So this is kind of giving you more of a background of how you end up treating, how you end up, again, customizing a plan for every person.
Correct.
Awesome.
Yes. Appetite and diet are next. We have them write down what they eat, if they have a lack of appetite, if they have insatiable hunger, bloating after eating, desire for hot foods or cold foods, spicy, sour, salty, sugar, caffeine, alcohol. If you crave one thing or the other, that tells us also where to look.
And why does that matter, if you don't mind me asking?
Yeah, absolutely.
The food part.
So why does it matter? Because health is in your gut, digestive health. So frequently we see people come in with the issues such as skin issues or migraines, and much of it is due to their food choices. So I usually have patients go on like an autoimmune protocol diet.
Tell me more about that.
Autoimmune is restrictive, so you cut out eggs, peppers,
Okay.
coffee, tomatoes, dairy, and then grains for
Is
about
that-
30 days.
Is that all at once, or are you taking those out?
No, you
one
take it
by
all
one?
out,
Okay.
all at once.
One
So
big
it's an
swoop.
elimination diet, and then you
Okay.
want to see when you add one of them back in, how your body responds, right?
Gotcha.
So I did something similar to this maybe a decade ago. And I was on it for 2 years. And I felt outstanding. No joint pain, no scoliosis pain, no knee pain. I have so many injuries. So much better. And the gums of my teeth were pale pink. They didn't bleed. The whites of my eyes weren't bloodshot. Yeah, so it's outstanding. So that's normally what we recommend. And then you have them add it back in and then see what triggers a response in them, whether it be migraines or an all-over body rash.
Got it. So you eliminate that because, again, the whole body. I love it.
Yeah, absolutely.
I also know you're a big fan of meditation, and I want to kind of pick your brain on this a little bit. How long have you been practicing meditation for?
For about 15 years.
So what got you into meditation?
Oh, goodness. How did I get there? Oh, probably. I started yoga I know exactly. So I was in freshman year of college, must have been. Freshman, sophomore. It might have been for my master's at this point. I don't know. I have so many schools. But it might have been for my master's at this point. And I remember walking into the gym for the yoga class, and the guy across the room had white hair, and he looked like he was in his 30s. And then when he introduced himself, I could tell he was much older, maybe in his 60s at that point. But he was in outstanding health. And it would be a room full of all the athletes and the young guys, and what he put us through, to make you know that yoga's not easy. He would torture us, but in the best way as possible. And that's how I got into yoga and meditation. So, and then when I would ride down on the train, the hour and 20-minute ride to Manhattan, I would meditate the whole way down and the whole way back. So, and that changes your life.
It's a long time to be meditating.
It is a long time. You don't really need an hour and 15 minutes.
Okay.
But you get addicted, and it's a beautiful peace that comes over you.
Incredible.
Stillness. Mm-hmm.
So for those that are like starting out, they're listening, they're into meditation, or they've tried some things. Like, what do you recommend to get people started?
I recommend you can do the app, the Headspace app.
So Headspace is the one you like, okay?
Yep, that I'll recommend. If you really need a guided meditation, you need instructions. Mm-hmm. Or I have patients do breathing.
Wonderful.
Yeah, breathing, one in, one out, and pay attention. I would put Zen temple music on. Mm-hmm. And then I also have them use a mala, which counts your meditation reps.
Ooh.
Yeah, so it keeps your body active, your hands active.
Okay. So you're kind of staying consistent with it. You have focused on what you're supposed to be doing and not what you have to have for dinner that night.
Correct.
Perfect.
Yes.
Understood. This sounds more up my alley because my mind's always going like 1,000 miles an hour. So
yes.
So they're laying on the table here, and you do use needles. Do these needles hurt?
These needles don't hurt most of the time.
Okay. All right.
So your insertion's not going to hurt. Sometimes when you do trigger point or what PTs call dry needling, the muscle fasciculates, it jumps, and that feels like when you have an e-stim on up high.
Okay.
And the muscle triggers.
Kind of like a shock or a jolt.
Maybe not a shock, but just that the muscle is a quick twitch, and it's weird.
Okay.
So then I wouldn't say it hurts. Some people are fine, and they don't even... They have no reaction, and I could trigger point them all day. Another person, one might be enough, and one twitch of the muscle, and they're like, okay, move on to the next spot.
Gotcha.
So everyone lies in a different spot. I also noticed that people that are more stressed respond.
Stronger response.
Stronger response, but they're easier to be unsettled. Mm-hmm.
Understood.
Yeah.
Understood. So she does the needles. You do a little cupping. You do Gua sha. And gua sha is with the rock, as I understand it. Or with the blade. Describe that more.
So I use,
Okay.
and then most of us do, but we use lids with a certain diameter, and I don't know what it's called, but it's like the lip of the lid.
Okay.
So there's a certain measurement, and that's really what you want, because when you use metal blades or bone or jade, not only is there's a sanitization issue, but it's not the right measurement caliber to get the sha to come up, the blood to come up out of the capillaries.
Okay. Understood. So again, very thin needles.
Yes.
Because I'm coming for the first time, I'm not going to be...
Yeah, nice and easy. No, they're super thin and you won't feel them on insertion.
Gotcha.
You'll feel the muscle twitch though.
Okay. The
if you're going... Yeah, the fasciculation.
The jump. Yep.
If you're going for sports acupuncture.
Understood.
Yeah.
Understood. So what's the difference between sports acupuncture and maybe regular acupuncture?
So the sports acupuncture, the acupuncture physical medicine, the APM, is what I was trained under in Tri-State. That's the one with the fasciculation and the trigger points. So if you get a Dr. Janet Travell's book and you see all that, those are those points that we're going for to make the muscle fasciculate. If you're going for, it depends, there's different styles. So you have Japanese, Korean, Chinese. So I was trained in Chinese, Japanese, and what I call American, but the acupuncture physical medicine, the sports medicine. The Japanese is a bit more gentle.
Okay. Gotcha.
Softer feel, very much like the culture, you know. And the Chinese is a bit more direct and intense. There's more twisting of the fascia around the needle, which you'll only feel like a dull ache. You really won't feel that much. And the Japanese is slight, small stimulation.
Understood. So everything's got a little bit of variation, but you essentially do it all.
Yeah, meld them together.
Wonderful.
Yeah.
Lindsey, tell us where we can find more about you. I mean, I know you have an Instagram page. Where do we go?
Instagram is my full name, Lindsey Miuccio.
You got to spell that for the crowd. Yep.
Lindsey. M as in Matthew. Iuccio.
Perfect.
Yeah.
Awesome. And then because it's the Stay Healthy San Diego podcast, and although I know you're prone to New York, I want to talk about a little more about San Diego. So
absolutely.
What's your hidden gem? What's the restaurant? I always ask people this question. So what's the your go-to, maybe that more people should know about but don't, one you have in your back pocket?
Miramar Fish, Tacos, and Beer.
Ooh.
It's up off the 76.
And what do I get when I go there?
You need to get the shrimp and steak burrito.
The shrimp and steak burrito.
Yes.
Okay. Perfect. Say
best
no
burrito
more.
I've ever had.
And your favorite activity to do in San Diego, Miss Lindsey?
Lie by this beautiful beach after I complained about all the sun.
Yeah, weird how that works. You're probably a happier person. You're not in Manhattan anymore.
Yes, so much better.
You don't have to shovel snow. You get to wear sandals and hang out. So awesome. Well, Lindsey, thank you so much for being here today. I hope you had a good time. And
great time.
For everyone, all the show links will be on the webpage there. Other than that, you guys have a good one. Take care.
Thank you for listening to the Stay Healthy San Diego podcast brought to you by Parker Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, painkillers, or just want to get back to doing the things you love in and around San Diego, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at parkerphysio.com/health-tips. There you'll find ebooks for topics such as low back pain, sciatica, shoulder pain, knee pain, and neck pain. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit parkerphysio.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation telephone consultations with a doctor of physical therapy to residents of San Diego. Just call us at 858-900-3361 or visit us at parkerphysio.com and click the Talk to a PT on the phone button. Thanks again for joining us, and we'll see you next time on the Stay Healthy San Diego podcast.